If you're suffering from any kind of pain, especially occurring in one side of the face, which is a kind of stabbing pain or a throbbing pain, or sometimes as a sharp electric shock kind of a pain, which is even associated with sometimes burning sensation, this kind of a pain aggravates when you are chewing or when you are talking to somebody or even when you are smiling. This is described as Shankaka and Anantavada in Ayurvedic text. Modern medicine describes this as trigeminal neuralgia. Now, what exactly is trigeminal neuralgia? Trigeminal nerve is the fifth cranial nerve. There are in fact 12 pairs of nerves that originate from our brain and spreads to different parts. Trigeminal nerve is spreading to one side of the face, to the upper part, that is to the forehead, and to the jaw, to the eyelids. This nerve is responsible for the pain and the touch sensation that we feel in one side of the face, as well as for some of the actions like biting or chewing. Now, sometimes what happens is when this nerve gets injured, like say for example during an accident, or sometimes after a facial surgery, or sometimes even after a dental procedure, sometimes there is a pressure exerted in the area of the nerve where it is coming out from the brain and it is entering into the cheek area. So the pressure can be exerted either due to a tumor or due to cyst, or sometimes even by the artery or vein that is closer to that nerve. So what happens is, due to continuous pressure, the outer covering of the nerve, that is, we call it as myelin sheath, so that gets destroyed. There is demyelination that happens. This leads to hypersensitivity, that is, the pain and touch sensation becomes so intense, more than what a person can bear. And this can lead to many of these symptoms. Now, this pain sensation, it initially lasts for about 2 to 3 seconds, but the frequency as well as intensity keeps increasing. To such an extent it increases that the patient sometimes avoids social gathering, because talking can aggravate the pain, or sometimes even smiling can aggravate the pain. Sometimes they even restrict their food intake to just liquid items, because solid food, when they are trying to chew, that can aggravate pain. In some cases even brushing aggravates the pain. So ultimately this spoils the quality of life of a person. Mostly people beyond the age of 30, between 30 to 60, get affected with this disease. Sometimes it is so confusing for them. When they get this kind of a pain, they might think that it is a dental problem and they go to a dentist. Similarly, some people even go to ENT thinking that there is a problem with their ear. Or some people also think that there is some problem with the joint here, that is a temporomandibular joint, and they might use some painkillers or pain balms, which in fact do not give any result. Trigeminal neuralgia is generally diagnosed with clinical examination itself by an expert physician. Sometimes an MRI will be suggested to understand what the cause of this trigeminal neuralgia is. We have got a couple of cases of trigeminal neuralgia wherein they have undergone Ayurvedic treatment and they have got good results. The treatment that we generally give for these conditions are certain internal medicines and certain therapies, like fomentation kind of therapies, which we mention as kiri, and even talam kind of thing procedures, that is applying paste in the center of the scalp in the crown area. Similarly, nasyam kind of procedures, that is installation of nasal drops. So it will be a combination of all these for a certain duration. This trigeminal neuralgia is not very common, just like the other neurological problems. But when it occurs in a person, it is so intense that it spoils their quality of life, and hence it becomes very important that it has to be treated right in the beginning.